Welcome, doctors. Today, we're diving into an essential topic that directly impacts the care you provide to your patients: weight management therapy, and how we at Staffingly make sure that the process from intake to prior authorization goes as smoothly as possible. So, let's get into it. Initiating a treatment plan for weight management is far more than just scheduling a session. It's about making sure every step is covered: patient history, verifying insurance, and preparing all necessary documentation for prior authorization. Without this solid foundation, you might face denials, delays, or even unexpected out-of-pocket costs for patients. Let's walk through how Staffingly handles each step, ensuring your patients get timely access to care, while you stay focused on what really matters, helping them reach their health goals. So, where does the workflow begin? It all starts as soon as a patient shows interest in weight management therapy. Whether it's during a referral, a consult, or even just scheduling a follow-up, the clock starts ticking. For returning patients, the process may simply involve updating progress and confirming ongoing eligibility. But for new patients, we start fresh, gathering their medical history, confirming their insurance benefits, and prepping for prior authorization. Collect patient history and background. This is where we document all the critical details that justify the therapy. Things like the patient's height, weight, past health conditions, previous weight management attempts, and even formal lifestyle counseling if applicable. We enter all of this into structured EMR fields to keep everything organized and accessible for the next step. Now, step 2, verify insurance coverage. This step is crucial because we need to know whether the therapy is covered by the patient's insurance. Using their insurance card and member details, we log into the payer portal and confirm key things like whether prior authorization is required, retrieve prior authorization criteria. Once we know that a PA is required, we dig deeper into the payer's policies to identify exactly what they need. We check online portals, make phone calls to the insurers if necessary, and gather all required documentation, such as weight history, diagnoses, previous failed attempts at managing weight, and participation in lifestyle programs. Preparing the PA submission packet. At this point, we organize everything we've gathered: patient demographics, weight history, clinical notes, documentation of lifestyle changes. We make sure everything is clear, concise, and aligned with the insurance criteria. Submitting the prior authorization request. Once everything's prepared, Staffingly submits the complete PA packet through the insurer's electronic PA portal, or through platforms like 𝗗𝗶𝘀𝗰𝗋𝗋𝗄. We double-check that all fields are filled correctly, that the right benefit type and visit category are selected, and that all supporting documentation is attached. And of course, we save the tracking number and send a confirmation to the provider's office. Tracking, following up, and responding. After submission, we monitor the PA status daily through the payer's system, looking for approval notices, requests for additional information, or any denials. If we need more documents, we quickly retrieve and resubmit them. And if a PA is denied, don't worry, we work with you to craft appeal letters or resubmission packages. Staffingly stays on top of the timeline, ensuring that all progress data, weight updates, and eligibility confirmations are ready well before the original approval expires. Why does this workflow matter so much? When you follow this structured process, you ensure that patients get timely access to treatment, prevent billing surprises, and reduce the risk of denials. More importantly, it saves you hours of back and forth with payers, allowing you to focus more on patient care and less on paperwork. So, what did we learn? Weight management therapy is often covered, but only when the right steps are taken up front. Staffingly's intake to authorization workflow eliminates delays, avoids denials when they need it. When should eligibility for weight management therapy be checked? Ideally, this should be done during scheduling, or before the consultation begins. For new patients, we start from scratch. For returning patients, we simply re-verify if there's been a gap in visits, a change in the plan, or a policy update. How do you know if prior authorization is required? Simple, check the patient's plan via the payer portal, or give them a call. Most commercial plans do require PA for weight management therapies. Lastly, what happens if the PA is denied? If that happens, don't panic. We'll review the denial reason, gather any missing information, and either resubmit or appeal. Well, that's all for today, doctors. By following these steps, you can ensure your patients get the right care on time, while also streamlining the insurance and authorization process. Thank you for watching.